In today's modern world, the sharing of information and the creation of networking has allowed us to unlock a treasure chest of data.
I'm really seeing a lot of promise in the future of digital healthcare in Africa, seeing a huge transformation coming through the region.
In 2022, Morocco announced that it will create a national e-health system that will allow citizens to equally access the healthcare records and other online services. Kenya is a leader in mobile health technologies, such as health apps and SMS reminders. Close to over 40% of Kenyans currently use mobile health platforms. Egypt has begun the deployment of its new national health insurance system. This includes the use of an electronic medical record, all connected via a health information exchange. The aim is to improve healthcare access, quality, and efficiency by using digital healthcare technologies. South Africa is implementing a national health insurance system, which will create funds enabling the access of quality healthcare for all South Africans.
Dear friends and family, I'm Sam Amory, the Managing Director for Dedalus Middle East and Africa. As you know, Dedalus is a global software solutions provider. What you have seen already today is that Africa delivers healthcare in many different ways, with a massive focus on geographics and demographical needs. That being said, even in one country, you may have multiple different ways of how healthcare is delivered. We are here in the very beautiful city of Cape Town to talk to people to better understand their perspective of how healthcare is delivered. Additionally, we want to see how companies like Dedalus can help with the others in the private sector to better promote healthcare and to understand how they can intervene with the communities to deliver a better patient-centric healthcare system. Femi, thanks for coming in today. With your hat as the Global Chief Digital Officer for Dedalus, can you give us your view on the current trend of the transformation that is happening across Africa in terms of healthcare?
So when you look at the African continent, we've actually seen a wave of technology adoption. And I think when you look at it in the context of healthcare, wouldn't it be great if I had a conversation with my doctor on my phone and have true care experience on the back of that? And why is that possible today in Africa? We have pervasive use of mobile technology. We're beginning to see huge opportunities in terms of disrupting the current care delivery model using mobile technologies as well as telehealth. At the heart of healthcare is continuity of care. So the information needs to follow the patient. How often have we gone to a doctor and the doctor says, oh, I'm going to refer you to the hospital. And you get to the hospital asks you the same question your primary care physician had asked you. The reality is we all have electronic medical record solutions today. So if we unlock the treasure chest of data in our electronic medical record, then that is, the interoperability allows us to share that information, which then powers the continuity of care across the ecosystem.
Digital health technologies like the one we offer at Dedalus actually help manage chronic disease. There are multiple apps and wearable devices that can connect to our systems. These really become a point where it can help inform the decisions in the lifestyle and the treatment of patients. Mobile devices are almost available everywhere. Patients in remote areas today can use them to access telemedicine services. They can even help to promote better patient monitoring and even bridge the gap of access points between the physician and the patient today.
Governments hold valuable healthcare data that can provide insight into disease trends, public health needs, and gaps in healthcare delivery. Collaboration allows Dedalus to access this data, enabling the development of data-driven solutions that address very specific healthcare challenges and priorities. So in terms of the Africa healthcare ecosystem, how does data make processes easier in your view?
One of the pivotal things is that now patients can schedule their own appointments with the physician before they come. They can do it online. And for the physician, we get a picture of who we're expecting to come through before they even get there. That allows us to do planning for their care before they arrive, to actually manage the patient better, and makes it seamless for both the physician and the patient.
So booking an appointment sounds like a really simple thing. Explain to me a little bit more about the effect that actually has on the daily healthcare system.
In our setting, patients can get primary health care usually within a 5-10 kilometer radius, where they will be seeing a nurse. But if they need the next level care, where they might have to see a doctor or be seen in a hospital, that can be a bit of a distance, 25 and sometimes 50 kilometers away. And that makes appointment scheduling quite an important thing, to make sure that where they're going, they will be seen.
How do you think medical care and the systems are going to change in the future with the aid of data?
In South Africa particularly, we learned a lot of lessons around the management of COVID-19 and how we can use the data to manage the pandemic better. And that in a way sets the blueprint for us to plan for the future, both for the public health practitioners and the physicians as well. Our use of health information systems and having them permeating, where we can have a clinical record of every citizen from the cradle to the grave, will help us plan better for the health care of our population.
I'm Dr. Shamaine Cunningham. I work at UCT, where I'm a program convener in emergency medicine, and then I also represent global surgery.
What do you think the role of digital health is in the Africa healthcare ecosystem at the moment?
I think it's the future. I think there's so much opportunity. Patients can receive reminders to collect medication. They can receive reminders to take their medication. They could maybe access advice or learn about their condition. There is a possibility for us to maybe put things like first aid on apps, and people can access that if they're far away from medical care.
I'm really interested to find out about this new app that you have. Maybe you can tell us a little bit more about it.
Essentially, any user within the kind of society or community can press a button and they can immediately call for help, whether that's an ambulance, whether that's fire services, or whether they want other community members to assist.
What role do you feel that the healthcare private sector plays in enabling a better healthcare outcome in the communities?
So the private health sector predominantly serves people that have jobs, because people with jobs will have medical aid or medical insurance. So I think the first way that the private health industry can give back is by investing in communities. And that could be various community type of platforms or outreach, thinking about bringing kids together in a safe space where they don't need to be alone at home while their parents are maybe working, but that they have a space, a library or a space to connect, and a space where they learn skills. Actually having training and education, so to train up more nurses, to train paramedics, to train maybe even community healthcare workers, and that's another way to give back.
We believe that healthy life is a basic human need, a fundamental right that transcends borders, cultures, and backgrounds. Community plays such a crucial and vital role in the lives of many people here in Africa. We are lucky to have some incredible organizations that are focused on the well-being of the younger generation living in the underserved communities.
So Sam, welcome to Velokaya. So every day we have about 109 kids that come to our doors Monday to Friday.
Yeah.
That get food, obviously different menu for every day. I'll explain what Velokaya means. Velo is bicycle in French. Kaya is home in our native language, which is Xhosa. So it is the bicycle home.
Listen, I'd very much like to go out on a ride with you guys.
Okay.
Do you think that's possible?
That's definitely possible. We will get you into shape quickly.
All right, fantastic. Look forward to it.
We have so many programs at Velokaya. Your BMX program, your road program, and also the nutrition program, which is very important, and not forgetting the academic and the mentorship program. So all of those programs bring sort of a holistic approach into impacting the lives of the kids, and that's how we then engage with the community with all those specific programs. We pair the kids up with mentors. The mentor almost becomes a guardian for the child, where they then discuss all about the academics and how school is and what their future prospects are, to make sure that the kid is able to pass and become what they've hoped for in life. We adapt to the situations and make sure that the most important people out here or program are the kids, because they are the driving forces for us.
It's really wonderful to be here in the beautiful city of Cape Town to talk to people like Sipho and Charmaine, who have worked very hard with their communities. They've created opportunities for growth and development, and they've used their core pillar, which is education. Sipho works very closely with the youth group to create a healthier lifestyle, a more balanced nutrition, and he gives them skills that they can take into their adulthood lives. While Charmaine and her volunteer and research group raises awareness of digital health and that technology. The potential for digital health in Africa is vast. With the right policies, with the correct investment, and the right partnerships, we can improve the equity and quality of healthcare for everybody in Africa.
When we look to the future, collaboration has never been more important. Dedalus, along with the government and the private sector, has been working very hard to deliver innovation and digital transformation across the world by coming together and taking action.
I'd like to end with a great quote from the wonderful and the late Nelson Mandela. What counts in life is not the mere fact that you have lived. It is what difference you have made to the lives of others.